please tell me your name, who you are, and the name of the product you're here for.
I'm Herbert Krakauer. I'm the director of Vita TMS, and TMS stands for Therapeutic Motion Simulation. That's the product we make.
And what health problem does it tackle?
We mainly tackle people with neural disorders. That might be neural disorders from birth or by trauma, like stroke or paraplegia.
So there's certain things people can't do anymore?
Most people have big difficulty with movement. They have a bad balance. Often they have spasm. That's what we try to reduce and to help them with.
So how does the game, or it is a game, I suppose?
We are here at Games for
Health. Yeah.
And it can be considered as a game because we create a virtual three-dimensional world. The three dimensions are the pictures, the video, the sound, and the movement, because we create in sync with the motions, with the pictures and the sound, in sync movement.
So you hear a horse, for example?
And you feel the horse because you are sitting on a robot platform and you feel the real life movement of a horse.
Okay, maybe we can just look at the video of your company, see what it looks like.
Het is een extra aanvulling op de gewone therapie. Het apparaat dat geeft je een nieuwe dimensie aan. Het is geweldig. Er zijn ook zelfs spieren bij waarvan ik het verstaan niet wist dat die dood waren. Dat weer tot leven is gekomen. Mijn rug is veel soepeler geworden. Dus ja, daar ben ik wel heel blij mee. Ik slaap beter dan wat ik ooit gedaan. Ik loop overdag met rollator en voor mijn gevoel gaat dat steeds nog vooruit. Nu toch een stuk rechter ben gaan lopen en het gaat ook wat makkelijk. Wat de transfer betreft, dat hebben we zelf gezien.
So what good does this do?
It actually gives to people who are not used to move anymore the movement back. Basically, by giving them that movement, you reteach them. They get back they relearn the old movements that they forgot.
Mm-hmm.
You give that back to them.
But someone who can't move, does he ever want to ride a horse again? Is that?
Oh yes.
Yeah?
People who cannot move anymore, they are eager to feel movement again. And the moment they feel that movement again, they are so happy. It basically, it's a big step forward in quality of life for them.
Mm-hmm. So it not only teaches them something, it gives them back movement, but it also helps them to become more happy.
It's a body-mind thing. The people who experience movement again get happy. They get more and more aware because when you don't use certain muscles, you forget about them.
Mm-hmm.
We teach them to use them again on a pleasant way because we have all kind of fun attractions on the movies, and by doing so, the people get more and more flexible. They get a better balance. They get a good mood. And that is the step that helps them. That's the next step to become more self-supporting.
So who is it? What is the market?
In Holland there are over 300,000 people with chronic movement disorders.
That many?
Some of them very severe ones, and we are talking, even if we can serve 10% of them, that's 30,000 people.
Yeah, yeah.
It's
So
a lot
it's
of
a lot.
people.
Yeah, yeah. Who pays for it?
The insurance company, because it's part of the physiotherapy programs that they are allowed to as a chronic patient.
Is that something that was really fought for, or was it quite obvious that they should pay for it?
Yes.
Yeah,
Yes.
they recognized it immediately and thought, well, this saves us money because they don't have to go to physiotherapy anymore. And yeah,
No, well, they have to. It has to be done under supervision of a physiotherapist because although the movement looks quite as fun,
yeah,
there's a serious aspect in it. You can overdo it, so you have to do it under control and under supervision of a physiotherapist, and the physiotherapist can choose to do other exercises or to use our equipment.
what's the user response?
Joy,
Yeah,
compliments. It's the nicest product a manufacturer can think about, because the users are so grateful.
yeah.
It's really
you get
rewarding.
emails like that.
It's rewarding.
Yeah?
Yes.
So why is it placed only in Holland, or do you serve the whole world?
We started 3 years ago in Holland.
Yeah.
We tested it thoroughly the last 2 years. Now we are getting ready to market it, and we are starting it to market it here in Holland and in the United States.
Okay. So a big market.
Big markets.
So will you become rich?
Maybe.
But that's not the goal.
The goal
You're
is
trying to say.
our mission is,
Yeah.
because the company has been founded by myself and my wife, to bring this beautiful product into the market, and to see that many people benefit from it. And I have learned in my life, if you do things well, you get part of the reward, and that might be happy customers, and most hopefully we get our money back that we invested so far.
Does this? Well, my last question was, but it's not a good question, because my last question was: does this game do a better job than old-fashioned medicine? Does it do a better job than a physiotherapy?
No, it's a tool for a physiotherapist, and it might replace some other therapies. It might replace even some drug use, because if people are happier, they might use less drugs.
Yeah.
But that's not the main issue. The issue is that you can give quality of life to people in an easy way, low cost.
Yeah. Okay. Thank you very much.
You're welcome. Thank you.